Hey everyone, today I'm breaking down the key differences between the recent Human Metapneumovirus outbreak, or HMPV, and the infamous COVID-19. Both are respiratory illnesses, but they have some pretty big differences, so let's dive right in. First up, the pathogens and their origins. HMPV is caused by the Human Metapneumovirus, discovered in 2001, but it's been around since the 1950s. Most kids build immunity by age 10. COVID-19, on the other hand, is caused by the novel coronavirus SARS-CoV-2, and it was first identified in Wuhan, China in late 2019. Now, let's talk symptoms. HMPV usually brings mild to moderate symptoms like a cold or flu. Think cough, congestion, fever, and sore throat. Severe cases are rare and mostly hit high-risk groups like infants and the elderly. COVID-19 symptoms range from mild to severe, including fever, cough, shortness of breath, and loss of taste or smell. It can lead to serious conditions like acute respiratory distress and even death. Plus, long COVID symptoms can hang around for some people. When it comes to severity and impact, HMPV is typically seasonal, peaking in late winter and spring, and affects mainly kids and the elderly. COVID-19 has been a global pandemic causing significant disruption and over 6 million deaths worldwide as of 2023. Let's move on to transmission. HMPV spreads through respiratory droplets, direct contact, or contaminated surfaces, but it's less contagious than COVID-19. COVID-19 spreads via respiratory droplets, aerosols, and surfaces, and newer variants like Omicron are super contagious. In terms of treatment and prevention, there are no specific antiviral treatments or vaccines for HMPV. It's all about supportive care and good hygiene. For COVID-19, we've got vaccines, antiviral drugs, and monoclonal antibodies. Preventive measures include masking, social distancing, and vaccination campaigns. So what's the global impact? HMPV causes localized outbreaks, but hasn't led to global pandemics. COVID-19, however, has had a massive global impact, disrupting economies and healthcare systems everywhere. In conclusion, while both HMPV and COVID-19 are respiratory illnesses, HMPV is less severe, less contagious, and less disruptive. HMPV mainly affects vulnerable groups during seasonal outbreaks, whereas COVID-19 has had a broad and profound global impact. Thanks for watching. Don't forget to like, subscribe, and hit that bell for more informative content. Stay safe and stay informed.